Hello, welcome back. The topic today is diabetes and mental health. How diabetes affects mental health. So, diabetes, we all know, it's a chronic disease. It's a very, prolonged years of treatment. It requires prolonged years of treatment, life adjustments, lifestyle changes, diet, exercise, everything it involves. And where the blood sugar level is very high, because of the blood sugar is very high, the sugar cannot enter the blood cells like brain, heart. The sugar cannot enter the cells because there is no insulin. So you need insulin to push the sugar into the cell. So this is the diabetes. So these diabetic patients, because of the long-standing disease, they are 300 times more prone for depression. They have mentally issues are very common in diabetes, whether it's type 1, type 2, but people are at least 300 times more vulnerable for depression. So the depression will present as like body pain, stiffness, shoulder pain, neck pain, body pain. This is the way it can present. And apart from the depression, they even get anxiety. There is 20 to 30% chance of getting anxiety because of the diabetes. And fear, panic disorders can happen because they know the complications. They know the complication of the disease. They have seen, the people suffering because of the diabetes, so they can give the unnecessary fear. And because of the diabetes, uncontrolled diabetes, the body loses its regeneration, so they look burnt out. They'll have a feeling of almost the exhausted feel can happen all the time. So if any diabetics, if it's more than 2 to 3 years, the chances of this mental health problem is very common. So both diabetes as well as this mental issue should be treated simultaneously, especially because of the diabetes, the mental health will worsen, and because of the mental health, the diabetes will not come to control. The sugar will always be erratic. Either it's a low sugar or high sugar. Both can affect mental health. So suppose the patient themselves can treat them initially. So first is they have to accept the diabetes. They should accept, they should understand, and they have to change. They change the lifestyle, diet, exercise, food discipline, everything is very important. Number one, good sugar control. Because if the sugar is under control, the proper sugar level, the each cell in the body, from brain to heart, they can get the proper sugar. So that itself will give them some strength, kind of strength. Otherwise, even if the sugar is very high, these cells will not get the sugar, so they always feel tired. So that can aggravate the depression. So first is acceptance. Second is they should change the lifestyle. Then they should try to do exercise, walking, minimum 30 minutes of walking. So that itself will regenerate them. When walking improves the blood circulation, the oxygen goes everywhere, sugar is under control, so they can feel the mental health improvement. Like other techniques like breathing exercise, yoga, all these things also can help them. Meditation, these things can help their mental health. And in spite of all these things, their mental health is not that good, or because of the mental health, the sugar is not under control, probably they need professional help. They have to see the doctor, and they may ask for a psychologist, a psychiatrist to assist their depression or anxiety. So diabetes is a chronic disease, very common, can cause the mental health. Because of the mental health, diabetes worsens, and because of the diabetes, the mental health worsens. So both needs to be treated properly. Thank you.